health sector and worrying numbers as far as the health sector is concerned when it comes to blacklisting and corruption. The COVID-19 pandemic, remember, exposed the gruesome levels of corruption in the health and PPE sector. Several companies were reported to be part of this parasitic act, but not one has been blacklisted for involvement in corruption. That includes those that were implicated by the SIU in a 1 billion rands worth of irregular spending, especially at the Tembisa hospital. Remember, that was the big story at the time, and that's where all of these stories began to unravel. Well, let's get the response then from DA MPL. It's Jack Bloom joining us this morning. Also, Shadow Health MEC making time for us. Mr. Bloom, good morning. I appreciate your time as well. I just want to clarify, I just want to make sure that I understand this correctly. As these companies, if I have the number right, 92 companies, in fact, or was it 93 companies, were blacklisted, but they weren't blacklisted by the Gauteng Department of Health. Is my understanding correct?
That's correct. There is actually a blacklist of companies that should not be traded with, but not a single one has been put there by the Gauteng Health Department. In fact, of the 93, 18 were put there by the Western Cape Health Department, and 10 were put in by 2 DA-controlled local municipalities. Now, you would think that the Gauteng Health Department, with its long history of corruption and companies implicated in all sorts of things, would have put at least one company, if not dozens, in fact more, I think, on this blacklist, but not a single one has been put on. And I think this shows that they're not serious about fighting corruption, because what it means is that companies that have stolen from the department in the past may very well be getting business in the present. And I think that it shows a weakness in the system, and they really don't seem to be serious about fighting corruption.
Because when you talk about getting business, I mean, the word we all commonly use, Mr. Bloom, isn't it, is they can still get tenders from Gauteng hospitals. I mean, this is the situation we're dealing with. If they weren't put there by the Gauteng Health Department, it means Gauteng Health can still use them, still get the tenders, still not get any work done.
Well, absolutely, that's the point. So we've got, I think, there's hundreds of companies that have been solidly implicated in corruption over many years in the Gauteng Health Department, and I believe that many of them are still getting contracts from the department to this very day, because obviously they're not serious about consequence management. You see, I think the Gauteng Health Department is very much like Eskom. I think it's got internal criminal syndicates, and they have political protection, and that's why it's so difficult to fix up that department. Meanwhile, the people who really suffer are patients. Can you imagine that if the 1 billion rand that was misspent at the Tembisa hospital had actually been spent on patients instead of things like skinny jeans and armchairs for 5,000 rand each? So I think until we clean up the corruption and make sure that there are consequences for companies that crook the department, money's just going to get stolen, wasted, and patients will continue to suffer.
I know this was a question that was asked, and I think it was actually you yourself that asked this particular question, and it was the Gauteng Health MEC that actually then came out with this information. I can't help but wonder, though, if they're aware of this blacklisting but not done by the Gauteng Department of Health. Why has the Department of Health not blacklisted them? It seems like an obvious question, but I imagine the answer is more complicated.
Well, it's a Treasury blacklist, but obviously departments have to put implicated companies on this Treasury blacklist. Now, I want to know why Western Cape has managed to put a full 18 companies on this list, and Gauteng Health hasn't done it all. They say, oh, they can only do it if they've been convicted in a court of law and it's solid and all that sort of thing. But quite frankly, over many, many years of corruption, there's lots of companies that have been convicted in a court of law, but not a single one appears on this Treasury blacklist, and that's because Gauteng Health hasn't applied to put them on. I think it just shows, the lack of determination to root out corruption and have consequences.
Is there a way to force their hand? If this list exists and Gauteng Health is aware of it, is there a way to force the issue?
Well, I'm going to ask follow-up questions about particular companies that have definitely been involved in corruption and whether they've received tenders subsequently. I mean, one can force this with public exposure, but I'm definitely going to follow it up, why companies have not been put on in the entire existence of the Gauteng Health Department. They haven't managed to put a single company on a blacklist. And I can tell you now, there's hundreds that should be on there. And unfortunately, many of them are probably still making money off the department as we speak.
I was about to ask you about the money aspect of this, Mr. Bloom. Before I say goodbye to you, last question. Do we have any sense at all of the amount of money still being given to these blacklisted companies by the Department of Health in Gauteng? Is there a number that we're able to measure?
Not at present, because I'm going to do follow-up questions and find out what exactly we're still paying to these companies. But you can see that the extent of corruption is absolutely massive. You know, 1 billion rand the SIU uncovered over 3 years at one hospital, the Tembisa Hospital. I believe there's a scam at every single hospital. So if you multiply that, you probably get an unbelievably large figure. And I think until the Gauteng Health Department takes things seriously, blacklist companies, does criminal prosecutions, boots out the corrupt people, we're still going to have our hospitals in a terrible situation.
It's unfortunately the reality is, if anyone who's ever been to a public hospital in the last few years, you can see the damage that it is causing. And I appreciate the time of Jack Bloom, DA Gauteng member of the legislature, of course, and Shadow Health MEC. So lots of follow-up questions for those involved in this. Of course, we'll stay on top of that, but it's an awful number of companies that are blacklisted not to do business with the Department of Health, but none of them, and this is the astonishing part, none of them have been put on this blacklisting by the Department of Health itself. My thanks to Jack Bloom.